Good evening, Minister and everybody else. My name is Christine Corby. I'm the CEO at Walgett Aboriginal Medical Service. I also hold the position of the New South Wales Aboriginal Health and Medical Research Council, which is a consortia of 50 Aboriginal medical services across New South Wales. And I'd like to congratulate the Minister for her commitment to the partnership with Aboriginal medical services, and we're pleased to see things progress both at a state level, regionally and locally. Problem-solving approach. I'll bring up the problem first and I've got the solution. Commercial flights to Dubbo, from Dubbo beyond. Bree, Burke, Walgett, Cobo got lucky. 2008 they ceased. For Walgett, we've been operating as an Aboriginal health service, treating non-Aboriginal people as well, so let me get our history right. 25 years, and we've got about 80 staff and visiting personnel covering respiratory physicians, podiatrists, dentists, doctors, mental health counsellors, speech therapists, dermatologists, midwives, Australian hearing and drug and alcohol counsellors. So since 2008, when the commercial airlines ceased in our neck of the woods, because Walgett auspices Brewarren Aboriginal Health Service as well, it's cost us per seat on a charter flight twice the amount up to last year for the original commercial seat. So instead of $200 per seat, it was $400. We were calculating it and trying to review our financial predicament. It's going to cost us $600 per seat from Dubbo to Walgett. I mean, you can fly to Perth for that amount. However, this is the situation with rural communities. I suppose the solution is, and I welcome, and I'm very pleased to hear there's going to be a review of aero medical services. Certainly us as Aboriginal Medical Services, I'm sure we're going to be invited to contribute to that. But I suppose a solution would be, why can't we consolidate the aero medical services that go beyond Dubbo? When Minister Humphries was in opposition, and he was kindly supporting us back in 2008, he said he actually did an audit and there were more planes chartering after the commercial airlines ceased than there were. So it's just crazy. And whether someone, be it the RFDS, would like to take that up and try and consolidate. Reduce the seats that we all fly around and there's a milk run, I don't know. But there's got to be a solution, and maybe the review will identify that. But at the same time, it's a real issue for us as an organisation, because with the people that we are flying in, we're actually looking at going to Narrabri, which is only 2 hours from Walgett in the dry, to offer reduced services. So it's impacting.
Can I clarify, is this for patients or for health care deliverers?
The doctors, the dentists, the podiatrists, the people,
okay, thank you.
Let alone the patients.
Thank you, yeah.
Yeah, that's another story. But so Minister, we'd welcome to be involved in any review for our rural communities, and I see that could be a solution in the short term while the review's being conducted, seeing that there are a lot of air services on the ground.
Thank you.
But thank you.
Minister Skinner will take the question.
Thank you for that, Christine. I know we've discussed this before, and it's one of the things that I was discussing with Clyde Thompson at the RFDS, and certainly something that I'd be very happy to put on the agenda for part of this review. And if you've got anything written, Christine, please give it to us, because I think what you're talking about is very typical of the kind of problem that we can solve by much better coordination of services. You know, we've got planes flying people. At the moment, the flying doctors do a wonderful job with outreach clinics, and it seems to me that that's the kind of thing that we can extend to you, so that you've got those services that you need. And I'd be very happy to take on board those concerns of yours. So thanks, Christine.